Hi, how are ya? Tesla decided to join us, didn't you? He's been very needy today. I have good news. My blood work was all normal. I don't have thyroid issues, including Hashimoto's. B6 or B12 issues, they're all normal. My A1C was normal, and my blood glucose. I'm sure it's due to not eating sugary sweets. My sodium is normal, and other things like my blood creatine and EGFR. And those look at how well the kidneys are functioning. They were all normal. My potassium, calcium, and cholesterol are normal, and I'm thrilled. Next step might be to get a skin biopsy or corneal confocal eye test. I still need to call my eye doctor and see if maybe I've already had that done. I'm not sure with all the other eye issues I have. But possibly I'll wait until my next doctor appointment or my symptoms get worse. But today, I'll take another look at small fiber neuropathy and the pathology that leads to it. Small fiber neuropathy is a neurological disorder that involves widespread damage to the small diameter somatic and autonomic unmyelated C fibers and or thinly myelated A delta fibers. The symptoms are often pins and needles, stabbing pain, or burning sensation. It typically begins in the feet or hands, and as we age, it can affect other regions in the body. Some people will experience a more generalized whole body pain. You might even experience muscle spasms, muscle cramps, dry eyes, sexual dysfunction, orthostasis, or gastrointestinal dysfunctions. Muscle cramps can affect about 60% of those with small fiber neuropathy, which is believed to be from local mediators of inflammation released by damaged small nerves that excite intramuscular nerves. They are usually in the toes, feet, and calves. Symptoms are often mild and go unnoticed in the early stages. But over time, the symptoms worsen and progress to other areas of the body. A chronic cough could develop, dry eyes and or mouth develops. Autonomic issues are also part of the equation. Our autonomic system can cause abnormal sweating or abnormal temperature regulation. If these symptoms are part of your diagnosis, doctors may call it an autonomic neuropathy. Lightheadedness or fainting when standing up from hypotension, low blood pressure, or tachycardia, a fast heart rate, is also part of it. A tilt table test completed by a cardiologist in a hospital will diagnose your autonomic issue, like neurocardiogenic syncope, also called vasovagal syncope. Or you might have POTS, postural orthostatic tachycardia syndrome. That causes lightheadedness and rapid heartbeat, among other symptoms. About 50% of people with POTS have small fiber neuropathy. Glucose control is an important cause of autonomic issues. Vision dimness is a symptom too, And you might have an unsteady gait and weakness. Gastroparesis is also a symptom. It normally involves bloating. Gastroparesis symptoms include nausea, vomiting, heartburn, and feeling full quickly when eating, as well as constipation or diarrhea. Exercise intolerance can also be a problem. You might have trouble with emptying your bladder. The skin becomes dry and thin. Rigid or brittle nails and hair loss on the legs are symptoms. And you are hypersensitive to pain. Misdiagnosed autonomic symptoms are cardiac arrhythmia, colitis or irritable bowel, chronic bladder infections, skin allergies, or emotional stress. The pain attacks can be provoked by cold or warm triggers and are usually more severe during times of rest or at night. And these gone. I have frozen feet and my toes will actually feel like they're on fire at times. I'm back to wearing socks during the day and at night because the temperature has dropped a little bit and apparently just enough to make my feet cold. People with small fiber neuropathy can't feel pain in a very small area when pricked with a pin, but the hypersensitivity to pain in general, called hyperalgesia, and pain that isn't normally painful, called allodynia, is real in small fiber neuropathy and fibromyalgia. Small fiber neuropathy is a form of peripheral neuropathy because it affects the peripheral nervous system, which connects the brain and spinal column to muscles, and then to cells that detect sensations such as touch, smell, and pain. Mutations in genes can cause small fiber neuropathy. It's inherited. One copy of altered SCN9A gene or SCN10A in each cell is sufficient to cause the disorder. And here's the clincher. About 40% of people with fibromyalgia have small fiber neuropathy. That's definitely a reason to look into this. Small fiber neuropathy is also called small fiber peripheral neuropathy or small nerve fiber neuropathy. To get a diagnosis of small fiber neuropathy, a skin biopsy is the best way, according to some researchers. But there's also a corneal confocal microscopy test that can also be done at your eye doctor's office. We have an abundance of small nerve fibers in our cornea. So the corneal confocal microscopy is considered a non-invasive and quick means of getting a diagnosis. And some researchers say it provides a better means of discovering small fiber loss. There are other forms of small fiber neuropathy. One is called autoimmune small fiber neuropathy. It was too much to get all of that into this video, so I'll look at that soon. I know I've gone on and on about this. Be patient with me. I get passionate about topics that include fibromyalgia in the research, and I hope you learned something. I send you gentle hugs and support. Love you. And other things like my blood gluten, but possibly I'll wait until my next, which is to bleed my scrub creature, like corneal confocal One is called the audio. A skin biopsy by most researchers are the best way. Is a vagal syncope, small fiber peripheral neuropathy, but the hypersensitive